Did you just finish your orthodontic treatment with braces or Invisalign and now you're starting to see that your teeth are shifting little bit by little bit? You're scared that your treatment is going for a relapse. You're not alone. Hi, I'm Dr. Salman. I'm a dental specialist, orthodontist, Invisalign expert. I've been practicing for the last 15 years. Today, I'm going to talk to you about why relapse and what you can do about it. But let me quickly get into the video. Without further ado, let's start. Before I start explaining, I hope you love my content. Do share it with people who you think will find it useful, and keep subscribing to my channel. That will help me show up week on week, motivates me to give you honest advice, no marketing, real dental talk. As usual, I'm going to cover this video in multiple parts. Number one, we are going to talk about why teeth relapse. Number two, we are going to talk about what are the early signs that you can see to detect relapse. Number three, we'll talk about what you must do if you are experiencing relapse. And number four, how to make sure that you prevent relapse for your entire life. So let's get started. Why do teeth actually relapse? See, a relapse, think of teeth like memory foam. Teeth have memory, meaning wherever you push it, it will try to come back to its original position. That is, teeth are bound by fibers at different parts. Front teeth, back teeth, they have something called as interceptor fibers, periradicular fibers, interceptal fibers. All these fibers, they make sure that they start pulling teeth back into the direction from where they were moved. So if this problem persists, that's why we give you retainers. If you are not using your retainers properly, you will see over a period of time that the teeth are trying to shift back to their original position. So what are the common reasons for relapse? Number one is patients stop wearing retainers without the advice of orthodontists, without orthodontists officially flagging them to stop wearing. Number two, sometimes they can have unexplained growth, especially in teens. After treatment is finished, suddenly they have a growth spurt and they grow in different direction. Number three, they could have a grinding problem, nocturnal grinding or bruxism. And number four could be because they have habits that have not been taken care of. For example, they have thumb sucking habit or mouth breathing habit or tongue thrusting habit. These habits, if continued after finishing the orthodontic treatment, can still lead to relapse. Now let's talk about what are the early signs that you are experiencing the relapse. Number one sign is your lower front teeth. You can start seeing that there is slight crowding, and some of your teeth, one single tooth is protruding out. And next you can see that now your retainers don't fit as they used to fit earlier. That means they become too tight or they don't go in completely. Your bite starts feeling off and you can see small gaps reopening in your teeth, and you start wondering, why can I see this gap which was not there when I finished the treatment? If you notice even one of these small changes, react quickly. Make sure you make an appointment with your orthodontist and reach his office and explain that this is the problem. Let them review and fix it for you before it's too late. Now let's move to what you can do about it. If you still have your retainer and it's fitting fine, please make sure you start wearing your retainer full time instead of night time. Wear it 24 hours a day, like how people wear their aligners. Just take it off for you eating and drinking. That's number one thing you can do. If you have lost your retainer or the retainer is damaged or broken, approach your orthodontist and make a new retainer immediately at that position, so that at least from here onwards it will not get worse. If you're already watching me saying that you have a far worse relapse, then I'm sorry to say that you may have to undergo braces or Invisalign once again. Though it will not be as serious as how it was, maybe 3 months or 6 months, you can finish it, and after that you can go back onto retainers. Remember, retreatment does not mean that your orthodontic treatment failed. It just means that you're taking responsibility and correcting it before it gets worse. Your treatment would have been 2-3 years, but your retreatment may hardly take 2 or 3 months. So after this, finally, I am coming back to the most important aspect of this video, as to how to make sure that you permanently have no relapse for life. It's very simple. I know you will hate hearing this. You need to extend wearing your retainers as long as possible, though not every night. But what I do is, once first 6 months patients wearing full time, then I slowly observe, and if the bite is stabilized, we start cutting down the wear time. Then we make it few nights a week, then we make it one night a week, then once in 15 days. So like that, over a period of time, even long term, after 2, 3, 4, 5 years of treatment also, I ask the patients to wear the retainer once in a while, and ask them to do come in and get yourself checked once in 6 months and then once every year, so that we review long-term retention. So if you have these small habits and you can maintain and visit your orthodontist maybe once a year, I'm sure you're going to preserve your smile for life. Now, I know it's been a lot of aligners, braces, and Invisalign technology in the last few videos, but I was thinking, let us shift the mood a little bit. One common thing that people do, they chew a lot of gum. It's one of the most smallest habit, but yes, misunderstood. So in my next video, I'm going to talk about what is the chewing gum, whether it is healthy, unhealthy for you, and what things you should consider. Until then, see you in the next video. Goodbye.